In this video, we will explore normal vaginally delivery versus cesarean delivery with pros and cons. Certainly, here are some pros and cons for both normal vaginal delivery, NVD, and cesarean delivery, C-section. Natural process is the natural way of giving birth, which can lead to a quicker recovery for the mother. Lower risk of complications. Generally, NVD is associated with fewer complications compared to C-sections. Faster bonding. Immediate skin-to-skin contact with the baby is usually possible after NVD, promoting bonding between mother and child. Shorter hospital stay. Women who undergo NVD typically spend less time in the hospital compared to those who have C-sections. Cons. Painful labor. Labor pains can be intense and prolonged, making it a challenging experience for some women. Risk of tearing. NVD can result in tearing of the perineum, which may require stitches and lead to discomfort during the healing process. Unpredictability. Labor and delivery can be unpredictable, and there's a possibility of needing interventions such as forceps or vacuum extraction. Cesarean delivery, C-section. Pros. Planned delivery. C-sections can be scheduled in advance, allowing for better planning and preparation. Reduced risk of birth injuries. C-sections can lower the risk of birth injuries such as shoulder dystocia or brachial plexus injury, especially in cases of fetal distress or abnormal presentations. Lower risk of pelvic floor damage. C-sections may reduce the risk of pelvic floor damage and urinary incontinence compared to vaginal delivery. Control over timing. C-sections can be performed quickly in emergencies, reducing the risk of complications associated with prolonged labor. Cons. Longer recovery. Recovery from a C-section typically takes longer than recovery from vaginal delivery, with a higher risk of complications such as infection and blood loss. Increased risk of respiratory issues for the baby. Babies born via C-section may have a higher risk of respiratory problems compared to those born vaginally. Potential for surgical complications. C-sections carry risks associated with surgery, such as blood clots, wound infections, and adverse reactions to anesthesia. Impact on future pregnancies. Multiple C-sections may increase the risk of complications in future pregnancies, such as placenta previa or uterine rupture. Ultimately, the decision between NVD and C-section depends on various factors including medical necessity, maternal preferences, and the advice of healthcare providers.